Marijuana is the most commonly used illicit drug in the United States. In a 2009 study done by the National Survey on Drug Use and Health, 16.7 million Americans 12 or older reported using marijuana at least once in the past month. 7.3% of youths 12 to 17 reported using the drug. 42% of high school seniors reported smoking marijuana at least once in their lifetime. Common street names include Ashes, Gash, Jane, Texas Tea, and Zombie. The street price of marijuana varies by region of the country. True retail value of marijuana is difficult to obtain due to the illegal nature of the drug. Street reported prices average from $300 to $400 per ounce. So how does marijuana impact the body? The chemical THC is the active ingredient in marijuana. When marijuana is smoked, the THC quickly leaves the lungs and enters the bloodstream. Once in the bloodstream, it makes its way to the brain. THC works by interfering with cannabinoid receptors in the brain. The largest number of these receptors are located in the areas of the brain that control pleasure, memory, concentration, and coordination. The feelings associated with feeling high are induced shortly after THC is introduced into the body. Short term of marijuana use in low doses produces memory loss, inability to learn, difficulty in thinking and problem solving, poor muscle coordination and judgment, short attention span, dangerous driving behaviors, altered sense of time and space, and food cravings. In larger doses, marijuana produces hallucinations, delusions, poor memory, not knowing where one is, anxiety attacks or feelings of paranoia, and depression. Long-term effects of marijuana use include cancer, where marijuana contains the same cancer-causing chemicals found in tobacco smoke, breathing problems, it creates the same kinds of breathing problems that cigarettes do, coughing and wheezing, immune systems, the THC in marijuana can damage the cells and tissues in the body that help protect against disease, fertility, reproductive hormones are decreased, in men testosterone is reduced, causing decreased sperm counts, in women there are irregular periods. Birth defects can also be caused in unborn children. Buying, selling, and using marijuana is illegal. Penalties vary from state to state but can lead to prison depending on the severity, often based on amount of marijuana found and whether the individual was intoxicated at the time. Persons convicted of marijuana possession will lose opportunities for federal financial aid to attend college. In some states, employers are notified when an individual is caught with marijuana. Almost half of the states suspend the driver's license. One serious side effect of marijuana use includes anxiety and panic attacks. The most common unpleasant side effects of occasional marijuana use are anxiety and panic reactions. These effects may be reported by users, and they are a common reason for discontinuation of use. More experienced users may occasionally report these effects after receiving a much larger than usual dose of THC. Marijuana smoking or ingestion of THC increases the heart rate by 20 to 50% within a few minutes to a quarter of an hour. This effect lasts up to 3 hours. Blood pressure is increased while the person is sitting and decreased while standing. The most common disturbing reaction to marijuana is acute anxiety. The user becomes fearful of dying or going insane. Mounting anxiety may lead to panic. The reaction is not a psychosis, there are no hallucinations. The anxiety reaction is a milder version of the frightening LSD experience known as a bad trip. Though not as nightmarish experience as the use of LSD and other psychedelic drugs, it usually lasts for only a few seconds and are not necessarily disturbing. Sometimes they become a persistent problem which has been labeled post-hallucinogenic perception disorder. Marijuana smoking may precipitate flashbacks in psychedelic drug users. A few reports suggest that marijuana flashbacks also occur without the previous use of psychedelic drugs. The majority of all adverse responses to marijuana are panic reactions. People report beginning to fear that they are dying or losing their minds. Panic reactions or bad trips may become so severe to be incapacitating. Roughly 50% of marijuana smokers in the United States have on some occasion experienced this adverse reaction.